Welcome back to Harvard. The president scored a big win today at the Supreme Court, but in the court of public opinion, the health care law remains unpopular. That's mainly thanks to the individual mandate, the idea that almost everybody has to get health insurance or pay a penalty for not doing it. Well, today the president did defend or tried to defend that provision.
When uninsured people who can afford coverage get sick and show up at the emergency room for care, the rest of us end up paying for their care in the form of higher premiums. That's why, even though I knew it wouldn't be politically popular and resisted the idea when I ran for this office, we ultimately included a provision in the Affordable Care Act that people who can afford to buy health insurance should take the responsibility to do so. In fact, this idea has enjoyed support from members of both parties, including the current Republican nominee for president.
Of course, Romney has strongly defended mandates in the past. Himself, of course, he was vowing to repeal the president's health care bill. But will Obamacare become a major part of this campaign, given where his party stands on the issue? Will he have a choice? Mark Halpern, Time Magazine editor-at-large, of course, senior political analyst here at MSNBC. Michael Steele's former chair of the RNC. He's also an MSNBC political analyst. Michael, I have to ask you, in terms of the nature of this campaign we're facing with an unemployment rate that looks like it's going to be around 8, maybe a little higher, maybe a little lower, we pretty much know where the situation lies right now. So what will be the deciding factors? Will it be something like this that rolls out and becomes a bigger story even than it was today?
I think it has that potential, particularly if the Romney team does not come to the table with a level of specifics about what he would do. This whole repeal and replace idea, I love it. But the reality of it is, once the House moves next week to repeal, someone's going to have to start talking about what they're going to replace it with. Whether or not it gets to the Senate, that's irrelevant. What's important is that the messaging at this critical juncture, on the heels of this ruling, has to be one of taking the country to the next step in terms of what Republicans say. And I think this thing could be a sleeper in this election.
Have you heard any Republican alternative to the mandate for paying for this thing?
There are individual pieces that are out there that particularly the 14 members of the House who are doctors, the GOP members have talked about. That now has to come together in a comprehensive way to say, okay, if we don't do the mandate, what are we going to do? And more importantly, how do we pay for it? Because remember, you've got a lot of taxes that come online beginning next year, and that is how Obama was planning to pay for this. This now becomes, I think, a sleeper issue depending on how Romney defines it going forward.
You know, Mark, FDR had a wonderfully sarcastic way of talking about the Republican Party. They always take something the Democrats have just done and say, we could do that, too, in a way that won't cost you anything. They always do that after the fact. Can they get away with it this time, just saying it won't cost you anything? The Democrats will cost you this mandate or this penalty. We can give you pre-existing coverage. We can give you adult children coverage, et cetera, but it won't cost you anything.
Well, Chris, I don't think you have to look back any further than the last election we had in this country in 2010, where Republicans were shockingly deficient in offering an alternative to deficit reduction, but simply said the president's not doing a good enough job on deficit reduction, vote for us. They didn't have any ideas, really, about how to reduce the deficit in any serious way. I think it may end up being the same on health care. Look, people inside the Beltway and in the Northeast corridor, I think, are skeptical of the Bain argument. And yet we see out in the country that may work. I think health care on the other side may be it. When I go out with Governor Romney and he talks about repealing Obamacare, again, he's mostly with partisan audiences, but the reaction is as raw and emotional as anything else he talks about. And I don't think it's a reach at all to say Obamacare has taxes, higher taxes. Small business doesn't like it. Big business doesn't like it. Republicans have been talking for months about how Obamacare relates to the president's record on the economy. So I think for sure he'll talk about it, and I don't think he'll talk about it reluctantly. I think he'll talk about it as one of his strongest arguments of why Republicans, at least, don't think the president's managed the economy well.
Stay on this, Mark. Does the fact that the Supreme Court relied on the taxing authority of a president to basically give this constitutional muster, will that give the Republicans an argument right there?
They certainly think so. I mean, I read about 200 Republican tweets and press releases today, and almost all of them focused on that. I think the president's remarks today are a great start for him to try to make the case about why the mandate is a conservative idea, why it's a necessary thing. I think he's going to have to keep that up because I don't think Governor Romney is going to back off going after the law. And I don't think most voters are going to care. I may be wrong, but I don't think they're going to care about what he did in Massachusetts. If they don't like this law, he's the guy who says he'll get rid of it. As difficult as it might be to get rid of it, the incumbent won't get rid of it. He'll implement it.
Well, jump on this, Michael. Mitt Romney today said he disagreed with the court's decision and promises to repeal health care law if he wins the election. Let's watch him.
What the court did today was say that Obamacare does not violate the Constitution. What they did not do was say that Obamacare is good law or that it's good policy. Obamacare was bad policy yesterday. It's bad policy today. Obamacare was bad law yesterday. It's bad law today. If we want good jobs and a bright economic future for ourselves and for our kids, we must replace Obamacare. That is my mission. That is our work. And I'm asking the people of America to join me.
Well, that was rather automaton-like talking with a staff-written script, but it might work. Mitt Romney has strongly backed health care, however, mandates even, in the past. And, of course, the president's plan was modeled on Romney's own plan up in Massachusetts. Well, today the group American Bridges found video of Romney defending mandates in order to bring health costs down. This was from back in 2006, not a million years ago. Let's watch.
With regards to the mandate, the individual responsibility program, which I proposed, I was very pleased to see that the compromise from the two houses includes the personal responsibility principle. That is essential for bringing health care costs down for everyone and getting everybody the health insurance they deserve and need.
You know the Hall of the Presidents down there in Disney World, where you just sort of feed in the script and the voice of the statue just speaks a different line. Yeah. He just went from one line to another based on the script. How does he do this? I mean, Mark may be brilliant in saying the visceral attitude towards the health care bill. They don't care who chops this program apart. They just want somebody to do it, even if it's a guy who created something like it up in Massachusetts.
Absolutely, and I think that's going to be the cornerstone of the Romney strategy going forward. Like a lot of folks who are beginning to realize, I don't think he backs off of this. I think he pushes full steam ahead, and you know what he's going to do? He's going to link it to the economic argument as much as he possibly can, how it ties into jobs in the small businesses, the weight of the tax burden on the taxpayer as well as businesses. So I think this is going to round out very nicely for him. Interesting, though, is what the president does and started to do today is fashioning this, ironically, from a conservative, you noted it, a conservative personal responsibility argument, which I think is going to be fascinating for him to make, particularly since he was against the mandate before he was for it, and Romney was for the mandate before he was against it. So these two gentlemen have now crafted a very interesting dialogue for the fall campaign.
Well, I'll tell you one thing. President Obama doesn't want to talk about it anymore. That's my hunch. Anyway, he said so today. Whenever they start talking, move on, Mark. Every time I hear the word move on, that means please, I'm clinching. Let's talk about jobs, anything but this. Anyway, Michael Steele, Mark Halpern, thank you, gentlemen.